Thousands of children returning to school this morning in the face of a huge jump in new COVID cases across much of the country. The number of new cases reported in the U.S. last week hit an all-time high, reaching nearly 500,000 in one day. We'll hear more about a local call to switch students to remote learning in just a few minutes. But first, a visit today from Governor Kathy Hochul in downtown Rochester. The governor saying New York entered the new year with a new single-day case record. More than 85,000 people testing positive for the virus in the state. Jack Watson was there this afternoon and spoke with the governor about what her administration is worried about. He joins us live now. Jack.
Ali, the governor was very clear in her language this morning as she visited Rochester. Like you said, the state is not in a good place. The words from the governor, the COVID numbers are still high. And amid those numbers, several new details from the governor's visit today. First of all, a swath of new COVID testing sites across the state, including at SUNY campuses. The state also still working with schools on test to stay and getting test kits to schools. Also, a new distinction with COVID positives in the hospital starting tomorrow. The state will ask hospitals to provide how many patients are in the hospital due to COVID-19 and how many are in the hospital due to something else. Here is the governor speaking on that.
When we're looking at the hospitalizations of people testing positive in a hospital, is that person in the hospital because of COVID, or did they show up there and are routinely tested and showing positive, and they may have been asymptomatic or even just had the sniffles? Someone is in a car accident, they go to the emergency room, they test positive for COVID while they're there. They're not there being treated for COVID. Now, someone's conditions can worsen while they're in the hospital. I'm not saying that won't happen, but I just been doing a random call around to some of the hospital leaders that I touch base with, and I'm seeing numbers from 20 to sometimes 50%, but we don't have clear data right now. That's anecdotal.
That said, as the governor notes, hospital capacity is hospital capacity. And according to the governor, the latest numbers that she provided today, Monroe County has just 1.8% of ICU beds available and 13% of acute care beds available. We are live in Rochester. Jack Watson, News 8.